My name is Karen Gaudian. I work here in town at Ridgefield Social Services, and I'm the municipal agent for the elderly. I also do Medicare counseling, so during open enrollment, we're telling everybody to make sure you review your prescription drug plans with us. We do that as a free service. Today, I'm very excited to have Megan Finlayson and Ashley LaBelle from the department, the State Department of Social Services, and they're going to provide us with information on the Connecticut Long-Term Services and Support Program. Something that's very important, I get people in my office all the time looking for help for a loved one usually, and they're usually in a crisis. So we're hoping to share some information so you can prepare a little bit ahead of time in case the need arises. And we're hoping Megan and Ashley can help us make those plans. So I'm going to let them take over.
Hi, I'm Ashley. I work in the Waterbury branch for the Department of Social Services.
My name is Megan Finlayson. I work out of the Bridgeport Application Hub for Long-Term Services and Supports. I'm one of the supervisors down there.
So for long-term services and support, this program encompasses a broad range of paid and unpaid medical and personal care assistance when people experience difficulty completing self-care tasks as a result of aging, chronic illness, or disability. The program provides assistance with activities of daily living, such as eating, bathing, and dressing, instrumental activities of daily living, such as preparing meals, managing medication, and housekeeping. This can also include, but is not limited to, nursing facility care, adult daycare programs, home health aid services, personal care services, transportation, and supported employment, as well as assistance provided by a family caregiver. Long-term services and supports are delivered in institutional and home and community-based settings. The average time in a nursing home is about 2 years when somebody enters.
So this is basically an overview of some of the things we're going to be going over today. We're going to be looking at Medicare versus Medicaid. People tend to get them confused. We're going to look at some of the different eligibility requirements that we have for our programs, the different types of coverage, whether you're going into a skilled nursing facility or you're choosing to stay at home. The biggest questions we get a lot of times are on documentation, the documents that we're going to be looking for, the verifications that we need to determine eligibility. We're going to look at income, so a couple of terms we might use are applied income and income limits. Applied income generally refers to a portion of your income that would go to a nursing facility. Other issues we're going to talk about is if you are still married and you're living with your spouse in the community, we're going to talk about how those rules for long-term care, when one's, yes.
Speaking to the microphone.
Oh, sorry. When one spouse goes into a nursing home, you know, what the rules are in regards to keeping assets. And we'll also discuss boarding homes or rated housing, licensed boarding homes, sometimes also assisted living. I do know that there's a couple of assisted living homes that do get a stipend from the state, and they're considered boarding homes, but it's actually more of like an assisted living facility. So Medicare versus Medicaid. Medicare, number one, is a federal program. You're generally eligible for it when you turn 65, or if you've been on Social Security disability for 24 months. If you have a qualifying disability. The main focus for Medicare is hospital services. your doctor's visits, and then of course, your Part D, your prescription drug plan. There's more limited coverage for behavioral or mental health, long-term services such as what the state helps provide with skilled nursing and home care, and dental care is generally not covered under Medicare. It's funded through your payroll taxes and a beneficiary cost sharing. So a lot of times you'll see a deduction on your Social Security for Medicare Part B. Right now, the amount, depending on your income, is $164.90 a month. Medicaid is a state-funded health program. It is subject to federal rules and guidelines because it is part of a federal block grant. Expanded health coverage for low-income adults and families, as well as the elderly, blind, and disabled with disabilities. And it's comprehensive medical coverage. So it's going to tend to have your dental, behavioral health, dental care, eyeglasses, and it's for older adults and people with disabilities who live in the community and in nursing homes. Like I said, it's jointly funded by the state and the federal government. One thing with Medicaid is it is a means-tested program. So we are going to look at your income as well as your asset limits to determine your eligibility. And depending on, your situation, whether you're married or you're a single adult, the asset limit for our Medicaid programs for the age blind and disabled is $1,600 in total liquid assets. And this benefit, again, pays for most medical services, including the cost of care in a long-term skilled nursing facility.
So one of the programs that the state does offer is called our Medicare Savings Program. So the state of Connecticut offers financial assistance to eligible Medicare enrollees through our Medicare Savings Program, also referred to as MSP. If you qualify for one of the 3 Medicare Savings Programs, depending on your income, the department will pay your Medicare Part B premium each month, and that was that $164.90. That's the typical Medicare Part B premium. In addition, some enrollees will be covered for Medicare deductibles and coinsurance through this program. Our Medicare Savings Program is funded by Medicaid, and if you do want, to find more information, it is available on the state's website listed below. So this just is a little illustration over the different income limits for the different programs. There are 3 different Medicare Savings Programs you can qualify for. It is income-based. So our QMB, or our Qualified Medicare Beneficiary Program, pays for your Medicare Part B monthly premium, and it also pays for Medicare Part A and B coinsurance, co-pays, and deductibles. For single person, the income limit is $2,564. For married couples, the income limit for this program is $3,468, and that's monthly total gross income. So that would be your income before tax deductions or any other deduction. We have the specified low income Medicare beneficiary program, which only pays your Medicare Part B. And then we also have an additional low income Medicare beneficiary program. And that also only pays for the Medicare Part B monthly premium. One thing to note is that with the ALMB, it cannot be combined with Husky Health coverage. So if you're receiving Medicaid for long-term care services, you're not going to qualify for that ALMB.
So we have a few different ways of applying. There's an online application that you can go to our connect.ct.gov website. We also have our W1 LTSS form, and that is in the back. I know some of you had grabbed it. That is our application that is specifically for our long-term care programs, our long-term services programs, such as home care, skilled nursing, or care in a licensed boarding home. You can always visit our website. It'll go over the towns that are covered by each center. Generally, Ridgefield, in this area, Ridgefield, if you're going into skilled nursing, that application is going to be sent to our Bridgeport application hub on Housatonic Avenue in Bridgeport, and the address is there with where to send it. Otherwise, the online application is always fine. You know, there's no technically wrong way to apply for our programs. So, some of our non-financial eligibility requirements: you need to be a United States citizen or a qualified non-citizen of the United States. Qualified non-citizens are usually permanent residents that have been living here for a minimum of 5 years. You would need to be a resident of Connecticut. That's definitely important, because we actually do get clients that are applying from New York. They have family in Connecticut, and you know, we can't obviously grant benefits until we can prove that they're living here in the state. There's no length of time for a client to live in the state of Connecticut. They can live in another state and their family could want them closer, transfer them to a facility here, and they can also come here for specialty care. And so we don't need to be, say, living here, like I know, to get in-state tuition for colleges, it's like a year. That doesn't apply for our Medicaid programs. The age disability requirements are 65 or older, blind, or deemed disabled by the Social Security Administration or the Department of Social Services. We do have some disability programs for clients that are pending Social Security disability. There's a medical review that would have to be completed that we review to determine disability.
So going through the different options, we could cover either home care if you decide remaining home is best for you, or coverage for a nursing home if that is the better option for you. And most of the time it's our loved ones that help us make this decision for us. So it's always important to have them included. So our home care is handled by our community options located in Hartford. Another way of calling their department is home and community-based services. They provide opportunities for Medicaid beneficiaries to receive a wide range of home health and non-medical services in their own home and community. The DSS community options also include state-funded, which is also non-Medicaid, the Connecticut Home Care Program for the elders. This program does have a little bit higher asset limits to their program as well. It's just that you might have less coverage or less funding.
Is this talk essentially about Medicaid?
Yes.
Period.
Yes.
Okay, thank you.
You're welcome. And we also have, your option for skilled nursing care, which is just a high level of medical care and custodial care in a licensed facility. Level of care is another determination we do need. For home care, there has to be an assessment done through the DSS community options. So we call this unit also our alternative care unit. And if anybody wanted that phone number, it's 1-800-445-5394. And you would want to call to schedule an appointment for your home care assessment. We also require a level of care for facility care. So we can either have short-term or long-term. Short-term is usually longer than 30 days, but less than 6 months. You usually intend to go back home to the community. And then our long-term with somebody intending to stay longer than 6 months.
Okay, so required documentation, we have your completed application. We do have that W-1 LTSS form. A lot of times, you're gonna have your families involved. You're gonna wanna include powers of attorney. If someone is conserved, we'll need the conservator certificate from the probate court or proof of guardianship for disabled individuals. Another way of granting granting us authorization to disclose information on your case with family or any outside entities is our W-298 form and our W-3013. The 3013 will be sent to you after you apply. The 298 now needs an approved language if you're putting a skilled nursing facility as one of your authorized representatives. Some other things we're going to look for are your proof of private medical insurance. So if you have a supplemental health program such as AARP or Anthem or United Health. It's also a 5-year history of your assets. So we do a 5-year financial look back. And then proof of your gross income. That tends to be, we can look at tax returns, but if you do get pensions that tend to have cost of living, we're definitely going to want updated like letters or pension stubs from your pension provider showing the gross, and then if you have any health insurance deductions on that. And we're going to be discussing more on the assets as we go into our presentation.
So as Megan discussed, there is a 5-year asset history look back. We often refer to this as just a look back or the look back period. During this asset history review, we're looking for transactions of $5,000 or more. So proofs for what that was for is usually requested. The state just wants to make sure, money's not gifted or given away to qualify. That is not allowed for the program. So that's why those are reviewed. We also review questionable transactions. So this would be something outside of a normal pattern of spending. And, we're looking for maybe possible life insurance policies that have that same monthly premium, as some life insurance policies do hold a cash value. So some examples of assets, they're not, not limited to just this list. We have bank accounts, so you would have your checkings accounts, savings accounts, any IRA accounts, annuities, savings bonds, the life insurance, trusts, real property, vehicles. And then we do have an individual asset limit of $1,600 per person. And then if you are married, we allow $1,600 in assets for the person who we are considering institutionalized or the person receiving the benefits. And then an additional amount is allowed for the community spouse or your spouse living in the community. Elaborate or you're good?
Yes,
What is that amount for the community spouse, or does it?
We're gonna go over that. So currently, we do have some income limits for our community options program for the home care. Your gross income cannot exceed 300% of SSI, which is currently, as of 2023, $2,742. There's 2 categories for our skilled nursing coverage, and there's the categorically needy, which is that 300% of the SSI limit or under, and then the medically needy, which is over that $2,742. Now, we talked a little bit about this, but when you're residing in a facility, there is something that's called patient liability or applied income. This is the amount of personal income that you're contributing towards your cost of care in the skilled nursing facility. So that liability amount would be due in the month in which you have now spent 30 consecutive days in long-term care. Some deductions that are allowable are personal needs allowance, which is currently set at $75 a month for getting your hair done or, snacks, bingo, and some of the facilities, incidentals. There's a community spousal allowance. If you have a spouse that's still residing in the community that has a lower amount of income, they will divert some of your income to your community spouse to help them reside in the community. There's also a community family allowance. We don't see this very often, but in cases where we do have institutionalized individuals who have minor children, there is an extra deduction that allows for some support for their children from their income. Some expenses that are not subject to third-party payment, which would be Medicare, health insurance premiums or deductibles, co-insurance charges, or medical or remedial care. And then there is something called a rental diversion, and this is if you're going in for more than, say, 30 to 90 days, but you're gonna be there less than 6 months roughly, and you're planning on going home. There's something we call a rental diversion, and this would be a set amount that goes towards maintaining your home in the community. So it's a one-time lifetime benefit of up to 6 months. And if you're living with someone else, it's up to $400 of your monthly income. If you're living alone, it's $650. Keep in mind, we're always looking at your gross income. So when we're in the application process, a lot of times we're going to tell you that you should contact your pension companies to have taxes stop taken out, because we're not going to look at tax deductions. All income is counted pre-tax. One thing to keep in mind is veterans who do have benefits and do get financial benefits from the VA, when they go into a nursing home, they also get what they call an aid and attendance benefit, and that would be $90. So they would get that $90 a month from the VA in addition to the $75 of their gross income that they can keep from their gross income.
Can I,
Sure.
sorry. So somebody that has a rental home, that lives in an apartment, needs to go, they live independently, single person, they get $1,500 a month, their rent is $800 a month, they're only gonna be allowed to keep $600
It's
for
a
their rent.
max at $650 a month.
So they'll actually end up losing, because.
It's a possibility. Sometimes they'll work with clients, but I mean,
Okay, I just wanted to make sure I was reading.
yeah, it is unfortunate, but that is currently a max that the state allows towards the rental diversion.
Wow.
It's not enough sometimes.
No. So there are sometimes patient liability with home care, where you're going to see more patient liability with the skilled nursing portion. So the personal needs allowance for the home care part of the program is going to be 200% of that federal poverty level, which is, I believe, was it 2,742?
No, that's
That's the 300.
yeah. It's
We also still allow community spousal allowance, family allowances, and the expenses not subject to third-party payment.
So we referred to it as the community spouse. This is when you're going into skilled nursing or you're looking into home care for yourself and you do have a spouse that's residing with you, living in the community. They're an individual who is married to someone who would be receiving or applying for our benefits. And one of the things to keep in mind when we're doing the assessment to determine the amount of assets that you can keep, we're looking for what we call your date of institutionalization. The date of institutionalization is going to be that first day of a period where there's 30 continuous days of institutionalization. Whether that's a hospital stay or a hospital stay and short-term rehab that equals out to 30 days, that's where we start that assessment from. So the individual's asset limit is $1,600, and you are allowed to keep the community spouse is allowed to keep half of the assets. So the minimum amount that can be retained is 50,000. So if your joint total assets are say 125,000, then 75 of that would need to be spent down. You could only keep a total of 75 of that. If say your total assets are 50,000, you can keep all 50,000, because that's the minimum amount. If you're under that, we're not going to make you spend down anything. And that's what we generally refer to as the CSPA. If your assets are over the maximum allowed, which as of January of this year is $148,620. This includes stocks, bonds, life insurance policies. It also includes IRAs, investment accounts, cash on hand, second property. If you have a timeshare or you have a condo here and then a condo down, if you're a snowbird, the secondary residence is going to be countable towards that total asset limit. One thing we do look at is we're going to be looking at, when you're spending down, that fair market value is received when you're reducing your assets. Fair market value means you're getting a benefit. The money is being spent towards your or your spouse's benefit, which is key, and we'll talk about that a lot. One thing to keep in mind is there's no gifting allowed to children and stuff.
So before we start to discuss a little bit about the rated housing, just to kind of recap some of the differences, that Medicare is federally funded and administered program for health care coverage. Medicaid is also known as Title 19. It's jointly funded by the state and federal levels, and it is administered in Connecticut by the Department of Social Services. The part of Medicaid reviewed in this presentation is also known as Husky C. So you'll hear, Medicaid, Title 19, Husky C from our workers. Eligible members meet federal definition of age, disability, or blindness. We have the two types of, coverage depending on what your needs may be. Would be that nursing home coverage or home care through the DSS Community Options Team. There are various, forms and documents that are required for this application process. There are asset limits, and we review the different types of assets that are reviewed to determine eligibility for the program, the income limits and applied income for the program, and the allowances made or allowed for the community spouses. So rated housing is a term we also use for another type of a living arrangement. These are our residential care homes and rated housing facilities, also known as boarding homes.
So we do apply cash assistance to help cover the boarding home cost of these programs for our individuals who are ages 65 or older, or ages 18 to 64 and have been determined to have a disability by either Social Security or the Department of Social Services via our medical review board with Colonial Cooperative Care. They would also need to be legally blind. You must have a source of income to supplement. You can also get state assistance from the general fund if there's no income, which is also referred to as Saga Cash for boarding homes as well, while you're pending any type of Social Security disability. And the required documentations for this program, we have, of course, proof of citizenship and your identity, how, we can speak with family members, power of attorneys, guardianships, a W-265. This is an internal form the boarding homes have. They submit it to us when you are admitted or discharged, even for temporary discharges to go to the hospital or for short-term rehab in a skilled nursing facility. Proof of private medical insurance, and a 2-year history of your assets. It's slightly different. We're not looking at the full 5, we're looking at 2. And then, of course, proof of your gross income. The financial eligibility requirements are, the same. These are the different types of income that you can have. You can have Social Security income, SSI, earned income. We do see that in some of our disabled younger individuals who are in supportive employment through like the Department of Developmental Services, DDS. So they do get, small wage, they do earn like small wages with Goodwill or, the Kennedy Center, to name a few. Private pensions, any alimony that you may be entitled to, workers' compensation, and then if you have any paid annuities or trusts where you're eligible for the income from the trust. Usually that's interest income from the trust. This is just how we would calculate your benefit amount for the amount of cash, the assistance that you would get for a boarding home. The boarding home disregard is currently $389.70 from your income, and the personal needs allowance in a boarding home is $33.38.
And I just wanted to make 2 notes about the 2-year look back. So where a long-term care facility and home care transactions of $5,000 or more are reviewed, for the state supplement program, transactions of $500 or more are reviewed. So who can gather the information for you? So, you can gather the information yourself to provide to the department so that they can determine eligibility, power of attorneys, conservators, anyone that may be associated with your accounts. You might have a child on your account, just in case. They are, listed on the account so they can help gather that information as well. And you can go about gathering the information by visiting, or calling, sending a letter to any of the financial institutions to request the specific information the state is requesting. So a lot of times you'll see somebody either call on the phone to say, can you please mail me the requested documents. Also, you want to make sure if you are a power of attorney or conservator that you do provide the financial institutions with the documentation. So this is also another Husky-C program for Medicaid assistance for aged, blind, and disabled. And just in general today, there are several different kinds of Husky-C programs depending on the individual situation. So that was your facility, if you're for home care, or if you're in rated housing. And all of these programs do have income and asset limits which need to be verified. And should be verified not only with the application, but also at the renewals as well.
Okay, questions? I know it's a lot of information we throw at you about this program. Yes?
Will we be able to get a printout of all that we had seen on the screen?
It's actually all available on our website. We don't have printouts of the presentation. The state doesn't let us print it out and give it to people. But it is definitely all available on our DSS website at ct.gov/DSS, and you would look up long-term services and supports. There's links to it that you're able to get the form if you don't take one today. It has lists on all of our other programs, including food stamps, general Medicaid, temporary family assistance for mothers and fathers, single mothers and fathers with children that don't have any income currently. So there's a whole wide range of programs that the state does offer. We also have comment cards we're going to pass out. Just feel free to leave us some comments if you'd like. Any other questions on the program? Yes.
What about timing? When you apply for, you have somebody that's just gone from the hospital to a nursing home and
So
they're applying for long-term care.
usually, it's usually dependent on the nursing home. A lot of times our clients will go into a nursing home on a short-term rehab, which is covered under Medicare for up to 120 days, depending on their levels of care and things like that. And that's usually when the families are looking at everything and saying, oh, we're not gonna be able to bring mom or dad home, so now we need to look into this while they're getting rehab. And so typically, we do have, timelines. Generally, we would not deny a case before 30 to 45 days, unless, you've decided you want to withdraw or the client died in that period of time, which occasionally happens. Applications, it's all dependent on how many assets there are. If there's a lot of assets and there's a lot of things to review, and we're gonna need to keep going back to get more information, it's gonna take more time. You would have an assigned caseworker during the application process, so you'll have one point of contact. You and your family would have one point of contact. Whether, if it's for skilled nursing, it would be me or one of my staff in Bridgeport. If you're in the Waterbury catchment area, it would be with one of Ashley's staff, or there's several units up in Hartford now for home care, because that's a rapidly growing demand in our communities. So again, sometimes I try and keep my applications moving, but some of these applications I've seen can take years.
Oh,
I've had applications that take upwards of 18 months to 2 years,
wow.
from application to grant.
And that's because of the assets.
That's a lot of times because it's a very complicated financial system. Kids were mingling their finances with their parents.
Yeah.
There was a lot of transfers. The family maybe didn't want to cooperate with providing answers to things, and then we have to wait for probate to get a conservator involved if the client's incapacitated. So these are different kinds of situations that we tend to see. But, we always try to make it as straightforward and and get them done quickly, but sometimes that just doesn't happen, unfortunately. Like I said, it's all dependent on the financial situation of each individual client. All these applications are unique. I don't think I've ever seen one that is alike. And I've been doing long-term care now for 5+ years, so everyone is completely different, and I still get stuff where I'm like, what did they do?
Sometimes people don't plan to qualify for Medicaid.
You don't
It just
think you're gonna
happens.
outspend your assets. Another thing to keep in mind is, we're not promoting it, but, if you do have significant assets that you're starting to think of how you're gonna set this up, meeting with an elder care attorney is always a good option. That's if you have property, if, you have significant assets. It's, estate planning, they kind of will help you do things so that, some assets are protected, so that the state can't say, oh, hey, you have $100,000 extra, you need to spend this down. An estate lawyer or an estate attorney or someone that does estate planning can tell you, oh, hey, you're a community spouse, you're gonna have to, if you ever have to get down to that amount, then, you can start pre-planning, you can purchase your funeral contracts at a time and prepay them, so that your families and your kids don't need to worry about anything. You can also, if like one of your spouse has a lower income than you do, you can look at an annuity where you're turning an asset into monthly income, and therefore we won't count that asset that you purchased that annuity with because you're getting income from it every month. So you can, those are
some ways or some other excluded assets. We do exclude, I don't want to talk about some of the assets that.
Well,
excluded.
there are some, like, if you are disabled, a lot of times if you are long-term disabled clients, children who are disabled, their parents have set up special needs trusts. These are, of course, reviewed by our legal to make sure they meet the terms of our programs, but those trusts for special needs funding are excluded. We don't count the assets in these special needs trusts. But we have to look at the language, the establishing documents of the trust to determine that it meets all of the federal and state guidelines for it to be considered a special needs trust. If you're over the income limit for home care, one way to spend down is to create a pooled trust where each month you're diverting a portion of your income to get you under that limit for our home care program. So and that pooled trust would say pay for prescriptions or pay for like a person who comes in and cleans house for you, things like that. Snow removal,
Rent, mortgage.
Rent, mortgage, exactly. Utilities. It'll cover various programs like that. Any other questions?
I have
Yes.
a question. It might be a very simplistic overall view of this, but so basically if you make more than like, was it like 4,600 or bring in 4,600 as a couple, you wouldn't apply for like home care?
No,
in
you
home
can
care?
apply for home, if you're looking for two people to have home care, like a married couple to have home care, both have to be under that 1,600, because we look at them as separate individuals.
So 1,600?
So it's a total assets per person. If they both
You
want.
can't bring in more than 1,600 to apply for this?
For income.
You could have more in income. It's your monthly, it's your total assets, your bank accounts, your checking, your savings. When we're looking at those balances in your checking and savings account, if you have your Social Security direct deposited or your pension direct deposited, we subtract that monthly income from the balance. So say your monthly Social Security is $1,500 a month, but your checking account balance is $3,000. So we're gonna subtract that direct deposit of $1,500, you would be under the 1,600 asset limit if that checking account is your only asset.
But for income limits, if there are, one thing that you could do in order to meet the income limit is to establish what's called a pooled trust with the Plan of Connecticut. And they'll help work with you to determine, what amount that should be contributed or diverted into that pooled trust.
And that pooled trust would have a spending plan. So what types of expenses that pooled trust is designed to specifically cover. A lot of times it's any outstanding medical expenses, cleaning, rent, mortgages, utilities, your taxes, your property taxes if you own a house. That's what that money would go towards in that pooled trust. There's estate attorneys are the ones that would help you establish that. It usually has to be signed off on by an attorney, the spending plan and everything like that. But, yes,
I was just going to comment, your department, I would have, I believe must have quite a staff of attorneys.
Yeah.
we're not shockingly attorneys, although we do have a small contingent of attorneys that specialize in Medicaid and look at the regulations, but they usually are multitasking across a number of our different programs. Most of the people who are reviewing these, we are all eligibility workers, college educated, usually in social service backgrounds. Some people do have financial services backgrounds. Me, I'm political. I came from the legislative world of legislative government to state government, so that's how I came to state service. But they're fully trained, and we have a huge policy manual that we're trained to read the guidelines and then apply. And there's always, if you ever disagree with an agency decision, there is a fair hearing process that we do go through. You can always appeal a decision. and, it would go to a fair hearing officer. But we do have a number of attorneys, but not quite as many as you would think.
What about, long-term care in a facility versus home care? Is there a difference in requirements for your health? I know there's,
I'm not as well versed on all of the assessments of daily living, but they do have like a nursing staff. The Department of Social Services has a nursing staff that would come out and do a home care assessment to determine the levels of assistance that you would need with your activities of daily living. These are what we refer to as your ADLs, and these are dressing yourself, feeding yourself, being able to take your medication and handle your medication, cooking, toileting, showering, any kind of home care, things that you may need. So depending on the level of assistance that you might need, that's gonna determine. Usually when you're getting to the point where a person is getting to the point where they really need that 24-hour level of care, the state may say, let's start looking at a skilled nursing option. I have seen that, once or twice. A lot of our home care clients, they get to stay in their houses a few years longer, stay in the community a little longer, and then they transition. As they get older and their medical needs increase, they will transition into a skilled nursing facility. So it does happen, but if you're going from that home care program to, if you qualified under our guidelines for the Title 19 home care program, you're not gonna need to do a new application when you get admitted to a nursing home. It's a flick of a switch for us. We get the notifications from the nursing homes, and we update the system to reflect that you've entered skilled nursing now, and, we flip the program.
okay.
The only thing is if you own your house,
Yeah,
one thing, your Medicaid and skilled nursing will be pending until we get verification that you've listed the property for sale.
unless there's somebody still living.
Unless it's a community spouse still living in it, or a disabled child that it's gonna be transferred to. Of course, there's no penalties on transferring assets to children that are ruled disabled by Social Security.
Okay. But if there is a spouse, does Medicaid ever go back to the homes to collect after, or?
They do a closed case review to
We look at closed case reviews, but per a lawsuit that occurred a few years ago, this, on all of our programs, we no longer lien property as of July of 2020. So any property loan liens where, if someone was in a skilled nursing and they still retained their home, we would lien the property.
Right.
And when that person passed or when the house was sold, the state would say, well, we're
Yeah.
you have to give us a portion of the proceeds or whatever to pay back what, we unfortunately don't do that anymore. And it's unfortunate, when they changed it, it was a result of a lawsuit for our temporary assistance for needy families. So if they sold a house in the future, then they would have to pay back what they may have gotten from the state 30 years ago. So that was a result of a lawsuit, and when the state assembly changed the guidelines, they refer to all Department of Social Services programs rather than just our cash programs or just certain programs. They didn't
Right.
stipulate the types of services, so liens were removed across the board, so we no longer lien property. There is a closed case review that we will look at, but, we're generally, if you come into an inheritance or something like that while you're in a nursing home, or say your community spouse dies and there's assets there, then you're entitled to,
Yeah.
then the state's gonna step in with probate and say, well, we paid this much for this person's care. That money that this person would get needs to come to the state. So,
Okay.
yes.
Can you help me understand, this home care you're talking about here, The difference between that and there's something called CHCPE in Connecticut, right?
CHOPSI, yeah. I refer to it as CHOPSI. That is part of our Connecticut Home Care Program for the elders, and that falls under the home care that we're referring to. There's also our state-funded home care program, which does have less stringent eligibility requirements. So, but that strictly only pays for home care. That doesn't pay for doctor's visits or anything else, or medical transportation, co-pays, anything else. It would only pay for home health care aides in the home. It does have a higher individual and married couple asset limit. It's generally self-reported for income. We don't do a 5-year look back for that program. They're looking at like a couple of months of your assets, as opposed to the 5 for the regular home care Medicaid program.
So that CHCPE falls into.
It
this
falls
home care
into,
with the-
yep,
okay.
it does fall into it. There's a lot of different terminologies for the same programs. The CHCPE programs, there's different levels depending on the level of home care. Like if you're there's like Cat 2, Category 2, Category 3. That determines the level of assistance that you need in the home.
And who determines that?
That is determined by our alternate care unit that is comprised of visiting nurses and medical professionals.
And there's a separate application for that?
You can apply for that program with that W1 LTSS.
Yeah, I think I have the phone number in here.
A lot of times if you're working with one of your local agencies on aging or your town Department of Social Services, they have those resources to help you initiate the referral process. The Agency on Aging usually can start that referral process. We see a lot of that where, one of the, Southwest, down in Bridgewater, Southwest Agency on Aging that helps kind of coordinate home care and those visiting, a lot of it comes through private companies that are contracted out by the agencies on aging.
Thank you.
You're welcome.
Any other questions?
Josh keeps hitting a button and he's talking back to me today.
Yes. What percentage of the population ends up using some form of this care? How common is it? I have to look that.
We would have to look that up.
I know it's in the slide.
Is it like 10% or is it like 30% or something between there?
No, I only did the one for POV in here. I
Yeah.
didn't do, because I know there were so many different home care, like the waiver programs we call it. There could be like a Katie Beckett waiver, there's different disability determinations. And so the percentages vary depending on what type of assistance waiver you are. And some of that is age related as well.
It also comes from if you are a client of DDS, so if you're one of the long-term disabled and you get DDS services, you would qualify for home care through a DDS waiver with social services. So that's where we see young adults who have been disabled essentially since birth. We will see them, getting home care. That falls under also the Katie Beckett waiver, which is for medically needy children, medically fragile children.
Yeah, my screen is loading.
And like I said, it really varies because, especially since COVID, there is a large portion of the Connecticut population that is on some type of benefit assistance with the state of Connecticut, whether that's Husky A or CHIP Healthcare for Children for lower income children, or 1 in 4 people roughly are on food stamp benefits in the state of Connecticut.
1 in 4?
that was the last number I saw a couple of years ago. And during COVID, it was 1 in 4.
Yeah.
It was 1 in 4 individuals were receiving some type of SNAP assistance from the state of Connecticut. That may not be a maximum amount, but that would be something, whether it's like the minimum right now is $23 a month. It gets you pasta and bread and eggs. I don't know about anyone else's house, but bread and eggs, I spend $30 a week on that with my 2 kids. But, yes,
Yeah, just, could you define husky?
a husky is, there's several different levels of husky programs. There's Husky A, which is parents and caretakers and children under the age of 18. Husky B is for lower income children, where their parents may not qualify for Husky A, but they still need some assistance, and that usually has, like, you would have to pay a portion. Husky C is for the age blind and disabled, and then there's Husky D, as in dog, for our lowest income adults, 18 to 64, and non-disabled. So people who are not working, or in between jobs, they lost maybe their COBRA is too expensive, they don't really have any unemployment, they would apply for Husky. And so, and everything for those programs, for the, those are what we call the modified adjusted gross income programs. That all goes through our Access Health website, which is funded through the Affordable Care Act.
I'm able to get more of a definition of that on the internet, on your website.
Yes, yes.
Husky is Connecticut's name
For Medicaid. They named it after our Yukon mascot. A lot of things are called Husky in Connecticut because of Yukon.
Yeah, so I can't get the screen to load, but for long-term care service and supports, currently there's over 13,400 enrollees.
And in time. And like I said, that
And there are breakdowns, I know, for the different waivers, but that's
Yeah.
the most is over 12,000 of them for the Connecticut Home Care Program for the elders.
which is the CHCP program.
So it's mostly used for in-home care.
A lot of it is, there's much more of a demand for it, and that's only gonna increase because of COVID and the restrictions that happened with nursing facilities and some of the challenges that nursing facilities did face during the COVID pandemic. A lot of people are choosing to figure out a way to stay home longer. You know, depending on the level of care that you need, it can be cheaper, you get to stay in your home, you get to stay with your families, you know, but, I mean, I've been through this, you know, I do this professionally, but I'm not a novice to this either. I've dealt with it personally as well, with my own family members between home care and going into skilled nursing. It's never an easy decision by any stretch of the means. I'm always very sympathetic to it because I understand what families are going through when they're making these decisions about what's the best for their loved ones. It's not easy, but you know, you'll see a lot of times with dementia and Alzheimer's patients that it's just it becomes too much for the caretakers involved at home, for the community spouse, for the daughter, the son, the grandchildren, to keep that person at home. That person can get violent occasionally when they reach certain stages of the dementia diagnosis. I've seen, and it gets hard. It gets hard. So.
Is there a difference in qualification if it is a dementia for Alzheimer's patients? Because I heard once that there's not a lot of Medicaid beds if you have dementia.
Yeah, I remember we did go through this with a family member. It can be harder, you know, to find the Medicare, just because Alzheimer's patients have unique needs, which is unfortunate. It should all be under are the same Medicaid beds, but some facilities are more dedicated to Alzheimer's patients. Some patients, some facilities have more of a dedicated Alzheimer's unit in their facilities, so to speak, whereas some skilled nursing are more geared towards short-term rehab, some are a mix. It really depends. Like, I know in Salisbury, you have Noble Horizons, they have a wide range of facilities. It goes from that assisted living boarding home, so if you were in I think it's the cottages or something at Noble Horizons in Salisbury, we would cover for the cash assistance portion, it's considered a boarding home, but it's really assisted living. They're like little suites and apartments. Bethel Healthcare also has something similar at the Cascades. That's part of Bethel Healthcare, which is a skilled nursing facility. So sometimes they'll transition, they'll start in that boarding home assisted living piece, and then they'll transition to the 24-hour intensive skilled nursing cares. But I haven't heard that there's been a lot of limits on Medicaid beds. Recently, I do know they do have dedicated Medicaid beds. A lot of short-term facilities that specialize in short-term rehab have a dedicated section that is you can get in there on through Medicare. You may not, you would have to be transitioned to what they would term a Medicaid bed. Lord Chamberlain in Stratford is one of those facilities that has Lord Chamberlain Manor, which is more short-term rehab as opposed to the skilled nursing facility piece of it.
So if you go in under Medicare and your time runs out on Medicare,
It may not pay. We may not pay until they transition you to a Medicaid bed. We would only
So
pay
would
for
they-
ancillary
would they
services.
make you leave the facility or find
I
it
haven't
different?
seen, and you can always fight that.
Yeah,
That's always been able to be fought. But usually you may have to transfer around before you can get back into a Medicaid bed in that facility.
but they could move you out to a different facility that has a Medicaid bed.
Mm-hmm.
Okay,
Temporarily.
yeah.
Or you needed to get in, somewhere, for instance, and they, your family was like, well, we need to get you somewhere you can't, mom can't go back home. For instance, they will transition you to one nursing home, but you'll be on a waiting list for a Medicaid bed at another. Once you're active on Medicaid, so if you're going in with home care and you're already active on that Title 19 home care program, nursing homes, it's gonna be much, much easier because you're already active between Medicare and Medicaid. They're just, they won't put you on a list.
Put you where they have a spot.
Yeah, it can be tricky. A lot of times it's best to go in from a hospital. So if you're a family member who needs to get a family member admitted, I know from personal experience bringing that person to the emergency room, having them hospitalized a day or two for observation, and then saying they can't go home, 3 days. I think it's 3 days of observation for a Medicare approved stay, and then they can go in from there.
And not under observation.
Yeah, it used to be they
Right,
could
it
take
has to
stuff.
be admitted, yeah.
Has to be admitted, but, you can say they can't go home, we need to get them somewhere,
Yeah.
so.
And if you have a pending application, a lot of the facilities are more likely to admit as well if they are aware
Oh,
that
if you've already started the
if you started the
application.
process.
Okay,
Yeah.
that's good to know.
Yeah,
So what is the typical approval time once you apply?
it depends, if you have all your stuff, it's not a complicated financial situation, it could be a couple months, as opposed to a couple of years. I have one case that's pushing 2.5 years right now.
Because of probate. But I had a case
What?
that had to go in a month.
Partially because of probate is involved. He has an estranged spouse. They were never legally divorced or legally separated, and she resides in a different state. So there was courts and lawyers involved on all kinds of ends, but yeah. So, any other questions, concerns?
Okay.
Thank you.
Thank you.
Thank you.
Thank you very much.